The first stage of the inflammatory process causes the spinal nerves to become enlarged and swollen, as shown here. In addition to the swelling of the nerves, there is distension of the adjacent blood vessels, which become hyperemic. As the nerves swell, the subarachnoid space actually disappears, and very typically, the spinal fluid is squeezed out from in between the spinal nerves. As time progresses, the second stage begins. Production of collagen fibrils by the fibroblasts produces scar tissue, which causes the nerves to adhere not only to each other, but directly to the arachnoid and to the dura. You will note the scar tissue tends to envelop not only the nerve roots, but any foreign body and held in place. As the scar tissue continues to be deposited, the nerves become more adherent to each other, and you will notice that they almost become part of the wall of the thecal sac. Various patterns of scar tissue can be formed. These can be appreciated on imaging studies, particularly MRI. Normally, pain impulses travel to the brain by way of the dorsal root ganglia of the spinal nerve. When a normal dorsal root ganglia is stimulated, results in a short, quick pain impulse which is self-limited. If the inflamed dorsal root ganglion is stimulated in a similar manner, there is continued long nociception constantly being produced by the dorsal root ganglion to the brain. Inflamed dorsal root ganglia are so hypersensitive that even body movements, such as breathing, can elicit a continuing train of impulses to the brain. We will now observe actual operative photographs of the various stages of adhesive arachnoiditis. The view of the first stage shows the nerves to be swollen, obliterating the spinal fluid within the dural sac. The second stage shows progression of scar with the nerves adherent to each other and to the dura, and the third phase shows such severe scarring that opening up the dura appears to be an empty cavity because of the extensive scarring. If the scar tissue begins to calcify, it can produce a condition shown here, calcific arachnoiditis, which can produce progressive squeezing of the nerves leading to impairment of bowel or bladder. The disease-produced adhesive arachnoiditis can be a very cruel disease. This has been and continues to be a worldwide problem. This entity has been a difficult process to understand. Although adhesive arachnoiditis can be produced by exposure to different toxic agents, there is no question but that over the past 50 years throughout the world, the primary cause of clinically significant adhesive arachnoiditis has been the presence of iofendolate in the subarachnoid space as a means of diagnostic myelography. Any invasive myelogram is capable of producing serious complications of some sort. Iofendolate, however, has been unique in this regard over the years.